Hafa Day and Hafa Health Tips is a segment where we join our friends at FHP Health Center, bringing you news and information that you can definitely use to live a happy, healthy island lifestyle. And my dear friend, Dr. Moping Tam, is a physician over there. Doc, welcome back to the show. And you have spent a considerable amount of your career, if you don't mind me kind of peering into your CV, actually working in both urgent care capacities, and you've done some ER work too, right? And that's what we're talking about today.
Not ER. I've
Okay.
worked in primary care, and for the past 7+ years, I've been working in the urgent care at FHP.
Okay, and I would assume, even though I completely botched that fact, right? One thing I do know is there is a general misconception, probably from the community like myself, of if I'm not feeling well, if something happens to me, I've got concerns about my health. Where do I go? Where do I go? When do I go to urgent care, and when do I go to the ER?
Yes, that's a very good question we get faced every day. A lot of people hear the word urgent and they think that means emergency. And so when we, tell them that they're too sick to be seen in our urgent care, they get upset. So, just briefly, urgent care is we kind of fill in the gap between people who are well and going to see their doctors for routine care, scheduled appointments and whatnot. And then you have emergency where, you're critically ill and need, care immediately. We fill in the gap in between where you have a medical condition that needs to be addressed, pretty quickly, but not an emergency, needs to be addressed, but it can't wait until you see your primary care doctor, which could sometimes be weeks or possibly months away. So, for example, you went out riding on your bike and you fell off your bike and you have a bunch of scrapes and bruises and you want to get checked out. That would be a totally appropriate visit for an urgent care setting, not necessarily emergency. But
Conversely, if I fell off my bike and I separated my shoulder, or I broke my arm.
Yes, if you broke your arm, we could still, probably take care of that for you. But yeah, if you dislocated your shoulder, we would certainly, urge you to go to the emergency room,
Okay.
because you need to be sedated, and you need, IV pain medicine in order to get your shoulder back in. And
Plus,
that's
me being me, I'm crying like a
yeah.
6th grade girl.
But according to the American Academy of Urgent Care Medicine, basically it's, they say urgent cares are for medical issues that are somewhat acute, but that need to be addressed sooner than later. But not in a with it's not going to it's not a medical emergency that would necessarily result in death or a very severe illness if it wasn't dealt with within a 24-hour period. So like your sprained ankles, you got a cut while you're cooking, those are, you got a dog bite or some weird insect bit you, or you got a headache, you got back pain. Those are the kind of things, upper respiratory infection. Those are the kind of things what we typically take care of in an urgent care setting.
Okay,
Now,
tell you what, Doc, let's play a
sure.
game, right? I'm going to
Yes.
throw a bunch of hypothetical situations
Yes.
at you, and if you would respond, just for the edification of our audience and everything, would
Absolutely.
this be a ER situation or urgent care? Okay.
Yep.
I've thrown up twice in 3 hours.
You can come to urgent care.
Okay, that would be urgent care.
Here's the thing. COVID has kind of messed things up a little bit, because there are, pre-COVID, anybody coming in throwing up, we would have taken a look at them. And if we thought they were too sick to be seen in our urgent care, we would have certainly sent them on to the ER. But these days, if you come in with nausea, with headache, with stomach pain, you're vomiting, you have diarrhea, coughing, any of those symptoms, we'll still take care of you, but we're going to put you outside in our isolation tent to evaluate you. We will still evaluate you, but we are somewhat limited in our evaluation. You may end up getting swabbed for COVID if we think, your symptoms may be COVID related. We'll still do what exam we can do on you. But if we determine that, your vomiting, your abdominal pain, your what have you, is something that needs further evaluation that we couldn't possibly do outside in an isolation tent setting, we would still send you on to the emergency room for further evaluation.
Okay. So first one, if I am sick to my stomach and everything like that, probably go to urgent care.
Yeah,
How,
and we'll take a look at you, we'll assess you, but if we think you're too sick to be seen in our urgent care, we would send you along. And
okay.
that,
Next hypothetical situation. I'm experiencing shortness of breath. It's been this way all night, and I've started to turn like a little bit blue.
oh, for sure, ER.
ER. Okay.
Yes, ER, call 911, go straight away to the ER.
Okay.
Not-
I was hiking in the jungle out behind my house, and I believe I got bit by a snake. I don't know what kind it is and everything, but it seems to be very, very inflamed. And in the 30 minutes since I've been bit, it's hurting more progressively.
That's a tricky one. I would say ER just
Mhm.
because it's progressing.
Mhm.
And if you're starting to like have an anaphylactic reaction or something, the ER is a better place for that.
Okay. Okay.
Yeah.
So since you mentioned anaphylactic and possibly anaphylactic shock, I went out to eat with a bunch of my friends, and I had a wonderful meal that I've never had before. But all of a sudden, I'm breaking out in crazy hives, and the inside of my throat feels really, really scratchy, just completely out of nowhere. This has never happened before.
That's kind of a gray area. We could still see you in urgent care, but if we think, and we have EpiPens in our urgent care, so we could give you epinephrine if we think so. But if it looks like you're not responding, we'll send you on to the ER. But
Okay.
if you're in full-blown anaphylaxis, your face is swollen, your mouth is swollen, you can't breathe, then absolutely ER.
Okay. How about I was playing basketball with a bunch of friends of mine, including my buddy Clarence over at FHP, and I tried to juke him up because, of course, I think I'm Steph Curry, and I made a move and I heard my knee pop. I could kind of walk on it. I'm limping like a little bit, but I'm not, completely like hobbled.
Urgent care.
Urgent care. Okay. That could be maybe ACL,
Yeah.
MCL, something, but definitely not an ER situation.
No, I mean, you're hobbling. Nobody died from an ACL injury.
Okay.
We can put you on crutches, we can splint you, if we need to, we can order an MRI or X-ray, at the very least X-ray, to make sure nothing's broken. But
Okay.
yeah, for an injury like that, and we see a lot of those, for sure, urgent care.
Okay. I felt fine last night, Doc. I got up this morning and I've had a nagging cough, but I've noticed there is blood in my cough.
You should go to the ER.
That's an ER situation. Okay. And then what haven't we covered?
Oh, chest pain.
Oh, chest pain. Yes. Possible cardiac situation.
Yes. If you're having any chest pain, please go to the ER.
Okay. That's a definite ER situation.
Definite. And
Okay.
that's one, we get into arguments with patients about a lot because, they're convinced it's not their heart, but you
Mhm.
don't know that. There's a lot of people who are in, many levels of denial, thinking that their chest pain is not cardiac. But if you're having chest pain to the point that you feel like you need to seek medical care, then you need to go to the ER.
Mhm.
Also, if you think you might be having a stroke, we have people come into urgent care saying, I think I'm having a stroke, and they want to be seen in urgent care. And we tell them, absolutely not. You go to the ER. And the reason why those two situations are very similar, the stroke and the chest pain, is because, basically there's a lack of blood flow either to your brain or to your heart. And as we all know, time is heart or time is brain, meaning the longer you wait to get that problem addressed and try to return blood flow to those organs that are suffering, the longer you wait on that, the more heart tissue or the more brain tissue is going to die away.
Mhm.
And we don't want that to happen. So if you're having any kind of chest pain, or if you're having slurred speech, your face is drooping, you have numbness and weakness in your arms or legs, or you can't move it at all, and you think you might be having a stroke, without question, you need to go to the emergency room.
Okay. And what can I typically expect? Like if I should not feel well, and now, given the information you've presented, I know which path I need to take, right? But is there one that if I go to one particular, like the urgent care center as opposed to the ER, is that going to be the one where I might be there for 3, 4 hours and then I'm just an outpatient? They might make their diagnosis, maybe give me, again, if I'm feeling nauseous, they might give me something to settle my stomach and then send me home and say, rest it off, as opposed to like the ER where now I'm terrified that I'm going to be admitted.
So, I mean, it really depends on the issue you're going to be seen in, but obviously in both cases, you know, there needs to be an evaluation. We need to get a history. We need to examine you. And, depending on what you have, if we think it's appropriate, we may order certain lab tests or radiographic tests, X-ray, CAT scan, ultrasound, what have you, whatever we think is appropriate in your situation. And yes, those particular tests take time. They take time to do, they take time to get the reports back. And so, yeah, there is a little bit of a waiting time. And in both situations, they're both walk-in situations. In our urgent care, we do not take appointments. It's first come, first serve. So there's good and bad to that. If you come in at a time when there's no one else around, yeah, you'll be in and out in a fairly decent amount of time. But if you show up at the same time that 30 other people showed up for care, then yeah, there's going to be a little bit of a wait time because there's 30 of you and there's only a very limited number of us, and we can't divide ourselves, to see you that quickly,
But
especially if
I took my mom to FHP like years ago. She was really not feeling well. We were back on the road like in 30 minutes, with some medicine from the pharmacy and everything, and she felt fantastic afterwards.
and it could be that fast. At the same time, it also depends on how sick you are. If you have something very simple like a urinary tract infection, that's or if you come in with hives, those are things that are easily taken care of. But if the two people who are in line before you are having more significant problems, they have broken bones or maybe they have a cut on their arm that needs stitches, those things take time to take care of those people before we get to you. And so it's not everybody's coming into urgent care with hives or something simple. And so I think that's kind of the take home message is when you're a walk-in clinic, you really don't know who's going to walk through the door. Somebody could be, not that sick. Maybe they just need their medications refilled, and those are in and out because it's pretty straightforward. And then somebody else could walk in with a lot of medical problems that need a lot more care and investigation. And so, it's kind of the luck of the draw. But, I guess my point is, I'm trying to educate the public that no, we're not really wanting you to wait, 3 hours to see the doctor. That's not our intent. But our intent is to provide everyone with good medical care. And if sometimes that means that you might have to wait a little bit longer to see us, that's the price you pay for being able to be seen without an appointment.
And the sooner you go in, if you feel that something's wrong with you, the sooner they'll be able to get you out, and you're not going to sit there and feel bad. And it's a mental as well as a physical thing, right? You'll
Yeah.
be in a good frame of mind.
Yeah, and I understand when people are sick, they're not feeling well and they get a little bit impatient. I totally get that. But, to be honest, it's really not our intent to make you wait.
Of
But
course.
I think also we're so used to our culture now is we're so used to everything happening right away. You have businesses that promise you 30-minute delivery on pizzas. And so you have this mindset that, well, I can go through McDonald's and get food in 10 minutes. Why am I waiting 45 minutes to see the doctor? And so I think some of that sort of culture has kind of seeped into other aspects of our lives where we expect medical care just as quickly as we get our pizzas. But, it's sorry, it doesn't work that way.
Well, maybe
We're
I'm
not
blessed with
McDonald's.
maybe I'm blessed with the good Lord upstairs, gave me an extra helping of patience and everything. But I've always kind of said, okay, well, close my eyes, take a deep breath. This is someone who is learned, who is an expert in the field of taking care of me and everything. And if they need a few extra minutes to make sure that I get the best care possible, I'm okay with that.
Good. I'm glad. I wish more people were like you, Jason.
Oh, thank you.
Yeah.
Socially, that's definitely not the case, but okay. And Doc,
Yeah.
final,
But
final.
I should preface, I'm sorry. I should preface that everything we're talking about right now, I'm only speaking mainly about FHP urgent care. I
Sure.
cannot speak towards any of the other urgent care centers on the island. I'm
Oh,
just
of course.
talking, from what we do in our clinic. I think we offer a lot more services than maybe some of the other urgent cares on the island. We have a full service lab. We have a full service radiology. We don't just do x-rays. We have CAT scan, we have ultrasound, we have mammogram, we have MRI. That's full complement radiographic services. And then, with the pharmacy and the lab, they are open. Well, actually, the lab is open the same hours as our urgent care. So we can do labs at any time. There's no cutoff time period. And we have very long hours. Our urgent care is open Monday through Saturday, 8 a.m. to 8 p.m.
Okay, and now I think maybe we can wrap with this final question. Now that I know what decision I need to make, given, like it may be a very acute thing, like, again, I may have fallen off my bike, or this is something that's been nagging me for the last couple days and it's getting worse. I may have been bitten by a snake out in the jungle, what have you, right? Now that I know where to go, if I'm thinking urgent care, that's pretty much like a clinic like FHP, but if you're thinking ER, is that specifically I've got to go to the hospital, so GMH, GRMC, or Naval?
Whichever one is the closest to you.
Okay, so all about proximity.
Yes.
Okay.
Oh, if you live in Dedido, don't drive all the way down into Tamuning to go to GMH. Go to GRMC if that's the one that's closest to you. If you think you're having an emergency, you need to go to the closest emergency facility available. You shouldn't be driving around the island picking and choosing. You should just go to whatever's closest.
And that is why we're telling you this on this very segment, ladies and gentlemen, because knowledge is power. And if you know this ahead of time, hopefully when you come into a very delicate and very scary situation, you already know the path to take. So Dr. Moping Tam, we always appreciate it. Thank you so much for the insight.
Thank you.
All right, we'll see you next time. Thank you guys for watching Hafa Health Tips.